You can feel perfectly fine and still have something important happening inside your body. High cholesterol usually does not hurt. Early diabetes may not feel like anything. Kidney problems can stay quiet for years. And many nutrient deficiencies show up as symptoms people blame on stress, aging, or just being tired. That's why routine blood work can be so powerful, not because it tells the whole story, but because it can give you early clues before small problems become big ones. Today, we're going through 10 important tests every adult should consider discussing with their doctor. Quick note before we begin. This video is for educational purposes only. It is not medical advice, and it does not replace a visit with your healthcare provider. Also, more testing is not always better. The goal is not to order every test on the internet. The goal is to understand which basic screenings may be useful based on your age, health history, family history, medications, and symptoms. So use this video as a checklist for a conversation with your doctor. Now let's start with one of the most common and useful tests. Number 1. A complete blood count, often called a CBC. Think of the CBC as a basic dashboard for your blood. It looks at red blood cells, white blood cells, hemoglobin, hematocrit, and platelets. Why does that matter? Your red blood cells help carry oxygen. If they're low, you may have anemia, which can cause fatigue, weakness, dizziness, shortness of breath, or a racing heartbeat. Your white blood cells are part of your immune system. Abnormal levels can sometimes suggest infection, inflammation, or other conditions that need follow-up. And platelets help your blood clot. Too few or too many platelets can give your doctor important clues. A CBC does not diagnose everything, but it's one of the best starting points for understanding your general health. Number 2. The Comprehensive Metabolic Panel, or CMP. This test gives your doctor a snapshot of several important systems at once. It usually includes markers related to your liver, kidneys, blood sugar, electrolytes, and protein levels. For example, it can show how your kidneys are filtering waste by looking at numbers like creatinine and BUN. It can give clues about liver health through enzymes like ALT and AST, and it checks electrolytes like sodium and potassium, which are important for muscles, nerves, and heart rhythm. The CMP is especially useful if you take medications, have high blood pressure, diabetes, kidney concerns, liver concerns, or just want a baseline for your overall health. It's not dramatic, it's not flashy, but it's one of the most practical tests in preventive care. Number 3. A lipid panel. This is the test that looks at your cholesterol and triglycerides. It typically includes total cholesterol, LDL, HDL, and triglycerides. LDL is often called bad cholesterol because higher levels can contribute to plaque buildup in arteries. HDL is often called good cholesterol because it helps transport cholesterol away from the arteries. Triglycerides are another type of fat in the blood, and high levels can be linked with metabolic health issues. Here's the key point. High cholesterol usually has no symptoms. You may not feel chest pain. You may not feel tired. You may feel completely normal. But over time, unhealthy cholesterol levels can increase the risk of heart attack and stroke. That's why a lipid panel is so important. Number 4. Hemoglobin A1C and fasting blood glucose. These tests help screen for prediabetes and diabetes. Fasting blood glucose shows your blood sugar at one point in time. Hemoglobin A1C gives a longer-term picture, an estimate of your average blood sugar over the past 2 to 3 months. This matters because early insulin resistance and prediabetes can be silent. Many people don't know their blood sugar is rising until it has been elevated for years. And diabetes is not just about sugar. Over time, high blood glucose can affect blood vessels, nerves, kidneys, eyes, and the heart. The good news? Prediabetes can often be improved with lifestyle changes when it's caught early. Number 5. Thyroid testing, especially TSH, and sometimes free T4, depending on the situation. Your thyroid is a small gland in your neck, but it has a huge impact on energy, metabolism, temperature regulation, heart rate, mood, and even digestion. If the thyroid is underactive, people may feel tired, cold, constipated, depressed, or notice weight gain and dry skin. If it's overactive, People may feel anxious, sweaty, shaky, have a fast heartbeat, or lose weight unexpectedly. But symptoms can be vague. Many thyroid problems are easy to miss because they look like everyday stress or burnout. That's why TSH is often used as a first-line screening test. Number 6. Urinalysis, along with kidney function markers. A simple urine test can reveal more than many people expect. It can detect protein, blood, glucose, signs of infection, hydration status, and other clues. Why is this important? Because kidney disease can be quiet in the early stages. You may not feel pain. You may not notice anything unusual. But if protein is leaking into the urine or kidney filtration numbers are changing, that is something your doctor wants to catch early. This is especially important for people with high blood pressure, diabetes, a family history of kidney disease, or anyone taking medications that can affect kidney function. Your kidneys are filters, and filters need to be checked. Number 7. Iron studies, ferritin, and vitamin B12. If you feel exhausted all the time, it's easy to blame sleep, work, stress, or aging. But sometimes the issue is your blood's ability to carry oxygen, or your body's ability to make healthy blood cells. Ferritin is a marker of stored iron. Low ferritin can suggest low iron stores, even before anemia becomes obvious on a CBC. Vitamin B12 is important for nerves, brain function, and red blood cell production. Low B12 can cause fatigue, numbness, tingling, balance problems, memory issues, or mood changes. These tests can be especially relevant for people with heavy menstrual periods, certain digestive conditions, vegan or vegetarian diets, older adults, or people taking medications like metformin or acid reducers. Fatigue is common, but it should not be ignored. Number 8. Vitamin D. Vitamin D plays a role in bone health, muscle function, immune function, and calcium balance. Low levels are common, especially in people who get limited sun exposure, live in northern climates, have darker skin, are older, or spend most of the day indoors. But here's the important part. Don't just take high-dose vitamin D forever without checking your level or talking to a clinician. More is not always better. Vitamin D is fat-soluble, which means it can build up in the body. Too much can cause problems, including high calcium levels. So if you're wondering whether you need vitamin D, testing can help guide a safer decision. Number 9. Inflammation markers, such as C-reactive protein, often called CRP, and sometimes ESR. These tests are not specific. They don't tell you exactly what is wrong, but they can show whether there may be increased inflammation somewhere in the body. Inflammation can rise with infection, autoimmune disease, chronic inflammatory conditions, and sometimes other health issues. There is also a high-sensitivity CRP test, called HS-CRP, which is sometimes used as part of cardiovascular risk assessment. But this is where context matters a lot. A slightly elevated CRP after a cold, injury, or hard workout may mean something completely different than a persistently high CRP with symptoms. So inflammation markers should never be interpreted alone. They are clues, not final answers. Number 10. HIV, Hepatitis C, and STI screening. This one is important because many infections can be present without obvious symptoms. In the United States, the CDC recommends that everyone gets tested for HIV at least once as part of routine healthcare, and more often depending on risk. Hepatitis C screening is also recommended for all adults at least once, because chronic hepatitis C can silently damage the liver for years, and today, it is often treatable. STI screening, such as testing for chlamydia, gonorrhea, syphilis, and others, depends on your age, sexual history, risk factors, and symptoms. This is not about judgment, it's about health. Testing protects you, your partners, and your future. So those are 10 tests and screenings every adult should consider discussing with a healthcare provider. CBC, Metabolic Panel, cholesterol, blood sugar, thyroid testing, urine and kidney checks, iron and B12, vitamin D, inflammation markers, and infectious disease screening. But remember, the most important test is not always the most expensive one. It's the one that makes sense for you. Your age matters, Your family history matters. Your symptoms matter. Your medications matter. And your doctor can help you decide what's actually useful. If you haven't had a routine checkup in a while, this is your reminder to schedule one. And if this video helped you, subscribe for more clear, practical health information without fear, hype, or confusion.